Good afternoon. Healthcare workers in Cornwall say they are making increased house calls to help those struggling in the heat. The county now has 60 community health and wellbeing workers and operating in some of the most deprived areas. Those running the scheme say it's proving a lifeline for some residents during the prolonged heatwave. Lucy Fisher reports.
Knocking on doors in Camborne, Catherine Eastman is one of 60 community health and wellbeing workers in Cornwall, reaching out to residents here.
Okay, thank you. Okay, I'm going round everybody's houses, I'm just checking that everybody's okay. Obviously, we're going into another heat wave now.
I could not ask for a better person. She's supported me through some difficult things that I've been dealing with. And she's there always. She picks up shopping, she picks up my prescriptions, she drops off my repeats, and she comes and listens, and I think that's really important.
Catherine says they've been even busier because of the heat.
We have been busier, so we've been visiting people house to house and just checking that they're looking after themselves, including keeping up their fluid intake, making sure that they're not overheating. Many of the houses are really, really hot, so there's been a few people that we've supported to get fans that actually can just help improve their sleep at night time.
At the local community centre, a planting session begins. For some here, having the health workers on hand has been life-changing.
Well, I would be just home all day moping. I've got one good friend now, alive now, and I just feel so isolated. They made my life much easier, knowing that they're there.
90-year-old Pauline has lived in the area all her life.
Yes, I'm Camborne, born and bred. Camborne made, as they say. Just so lovely. It's opened up new avenues for me. I've made new friends. Well, a second family, really.
Cornwall was the first outside London to trial the scheme. Derek Thomas is the director. Would you say this is a nice to have, or is this something that's essential?
I think it's essential. In terms of return on investment, actually annually we're seeing a return of about £4.6 million for the investment we're making, which is the equivalent of £1 in, £2.33 out. What we're also seeing as well, which is a reduction in demand of services. So the amount of people that are attending the emergency department is reduced by about 11%, and also unplanned GP admissions have reduced as well by about 7%.
The scheme was copied from one in Brazil that's been operating for 30 years. It's hoped the Cornish model will continue to expand and similar support be available across the South West in the future. Lucy Fisher, BBC Spotlight, Camborne.